spent only on diabetes, its management and its complications, 11.5%. 6.7 million deaths were recorded by diabetes. Then 1.6 million adults have impaired glucose tolerance. 7.8 million adults have undiagnosed diabetes. This is the data of 2021 IDF data. $206 billion being spent on management of diabetes during 2021. 149,500 children were diagnosed type 1 diabetes during 2021. 700,000 more pregnancies were affected by diabetes. So these are very big numbers. अगर हम गौर करें कि कोविड से कितने लोग मुतासिर हुए, डेंगू से कितने लोग मुतासिर हुए, कितनी डेथ्स हुई, तो क्या वो इन नंबर्स को मैच कर सकते हैं या इन बजट्स को मैच कर सकते हैं? So we are not behind in this case. हम कहीं पे आगे निकले ना निकले, यहाँ पे हम बहुत आगे निकल गए हैं. 2016 में हमारी prevalence थी, it was approximately 11%. Then in 2018-19 का जो data था वो approximately 15 to 16% था, and the same prevalence continued till 2020. But the 2021 and 22 data says that we have prevalence of approximately 24 to 25%, which is so high that it means that our 1/4 of the population is diabetic. So 1 in 4 is diabetic. So total 33 million people are affected by diabetes in Pakistan. 3.25 करोड़ से ज़्यादा लोग हैं जिनको diabetes diagnosed हो चुकी है. 1 in 4 is diabetic, which is highest number globally. किसी भी मुल्क के अंदर जो figures हैं 1 in 6, 1 in 7, 1 in 10, 1 in 11, but we have 1 in 4, the highest prevalence. 400,000 deaths were recorded in Pakistan by diabetes in 2021. Then more than quarter of adults living with diabetes in Pakistan are undiagnosed. जितने लोगों को पता है उतने ही लोगों को पता है कि अभी तक diagnosed नहीं हुए. So that makes it a big number. और इसका एक impact जो है वो पूरे health system के ऊपर आता है. Diabetes is not just one disease, it's a bunch of diseases. From head to toe, everything is going to be involved, every system is going to be involved, with a lot of complications. So a big health budget is being spent on just managing this diabetes and its complications. Earlier we used to think that diabetes is a disease of pancreas. It's the insulin issue, insulin कम बन रही है या नहीं बन रही है, that was the issue. But with passage of time, we learned that this is not just one organ that is involved in the pathophysiology of diabetes. There are multiple organs are involved. So we have this ominous octet, the very famous one. GI tract is involved. There is reduced incretin effect. The incretin hormones are being rapidly degraded by the DPP4 enzyme. Skeletal muscles have the impact. There is a reduced glucose uptake. In liver, there is insulin resistance as well as there is increased glucose production by liver. Adipose tissue, there is increased lipolysis. Brain, there is neurotransmitter dysfunction. The appetite is more in such patients. Kidneys, there is increased glucose reabsorption by the kidneys. Then pancreas, 2 types of cells are involved, the beta cells, which are not making enough insulin or not making insulin, then alpha cells, they are making more of the glucagon. So this is ominous octet. So there are 8 different kind of defects that have been identified in the pathophysiology of diabetes. So we have one small activity that is present on the table. We have one chart placed there. So we are very familiar with all these oral hypoglycemic that we are using from last many years. बहुत सालों से हम उनको इस्तेमाल कर रहे हैं. इसमें सल्फोनाइलयूरियाज हैं, DPP4s हैं, मेटफॉर्मिन है, इल्कापोज है और SGLT2 inhibitors हैं. तो you have one small activity जो आपके पास इस वक्त एक चार्ट पड़ा हुआ है आपकी टेबल्स के ऊपर. ये एक छोटी सी kind of workshop है, just brainstorming, nothing else. ये कोई एग्जाम नहीं होने लगा. तो देखें कि ये जो आपके पास ओरल हाइपोग्लाइसेमिक्स के स्टिकर्स पड़े हुए हैं, ये कौन-कौन से ऑर्गन्स के साथ मिलके काम कर रहे हैं. कि पैनक्रियास के साथ कौन काम कर रहा है, इंसुलिन सिक्रीशन कौन बढ़ा रहा है, ग्लूकोज की रीअब्जॉर्प्शन को कौन कम कर रहा है, जो हेपेटिक ग्लूकोज प्रोडक्शन है उसको कौन कम कर रहा है. सो आपने ये लगाने हैं उसके आगे जहां-जहां उसका मोड ऑफ एक्शन है. सो यू हैव 3 minutes 3 to 4 minutes to complete this task.